my take here would be to say that saying that you are going to reverse the diabetes is a misnomer, and also it is going to create a false sense of hope among the patient's mind, especially in the younger population who get more attracted to it. So they follow a strict various forms of fad diets like keto diet, Mediterranean diet. I feel following these diet is not going to reverse your diabetes.
Hi, doctor. How are you?
Hello, ma'am. I'm good, thank you.
Doctor, can you tell us more about yourself?
So I'm Dr. Mohammed Tauseef. I'm a consultant physician and diabetologist practicing at Medicare Health Center, BTM Layout, Bangalore. I've been practicing since almost 16 years into practice. So I'm more into diabetes, practicing diabetology, and I do see handle internal medicine cases also.
Okay, that's great.
Yeah.
As a diabetologist in Bangalore's busy IT hub, how do you address the rise of diabetes in younger patients with hectic lifestyle?
As a practicing diabetologist, practicing at a IT hub like Bangalore, it's very challenging actually, because I feel people have a very busy lifestyle in Bangalore, and especially the IT sector. They have a stressful, very stressed life, and not follow a proper diet, and also they also have a sleep deprivation. So as a practicing diabetologist, I would concentrate more on creating more healthy environment, asking them for do some regular screening programs to look for diabetes and pre-diabetes, especially among the younger lot, and also create awareness among the patients regarding the complications that would happen if they do not keep their blood sugars under very good control. And also I'll be creating awareness on proper lifestyle, having a good sleep hygiene, and avoiding stress and anxiety, and if they are diabetic, taking their medications on time, and also dietary advice, and also go for regular follow-ups to have a good glycemic control.
Got it. So, doctor, what is some advice that you would like to give these younger audiences, like who are pre-diabetic and diabetic? What is certain lifestyle habit changes or things that you would recommend?
I would recommend, especially the younger population from the city of Bangalore, to follow a healthy lifestyle. If they are overweight or obese, lose the weight. At least losing 10% of their current weight would help them in a long way in preventing the development of type 2 diabetes or pre-diabetes, and also preventing the development of complications. So my take would be here to follow a healthy lifestyle, follow a proper diet, and avoid stress and anxiety, and take their medications on time, and practice meditation, and go for a regular follow-up to the doctor. So these would be my advice to all younger generation of current population in Bangalore, to prevent the development of type 2 diabetes as well as pre-diabetes, and also create awareness about the complications of type 2 diabetes among them.
Got it. What are some of the key challenges you encounter in your daily practice?
In my daily practice, what I have noticed is especially the challenges I face in the younger population, because because the younger population would find it very difficult to adhere to the lifestyle modifications that I recommend them, and also they find it very challenging to take their medications due to their stressful life, work pressure, peer pressure, and also sleep deprivation. So and also I find there is a lack of awareness about the diabetes related complications among the general population. So these factors matter a lot, because if you don't prevent development of type 2 diabetes, all the complications, it could definitely have a detrimental effect on the patient's health as well as the patient's family members as well, and could increase their financial burden.
Got it. So it's all about making those little small changes.
Yes.
Okay. All right. So in today's world, there's a lot of chatter about, a lot of brands are saying diabetes reversal, though my name is diabetes reversal, and things like that, very explicit claims that they're making. What is your thought? What is your perspective on it? Like, is it misleading for the patients? What is your perspective?
So yes, my take here would be to say that saying that you are going to reverse the diabetes is a misnomer, and also it is going to create a false sense of hope among the patient's mind, especially in the younger population or who get more attracted to it. So they follow a strict various forms of fad diets like keto diet, Mediterranean diet. I feel these following these diet is not going to reverse your diabetes. Of course, they're going to help you. I would say instead of using a diabetes reversal program, you could mention it as a diabetes remission, and also instead of concentrating more on diabetes reversal, these so-called programs should concentrate more on creating awareness about the diabetes, and also give a sense of good hope to the patients so that they can follow a strict lifestyle and follow the proper diet, lose weight, and avoid stress and anxiety, and go for regular follow-ups with doctor if at all they are a diabetic.
Got it. Got it. So, in the era of tech advancements with so many digital solutions coming up, what is something that you believe in would change the dynamic for a diabetic, to manage their condition effectively? What is it that would solve for?
I feel that using current there are many mobile apps that are available currently in the market, digital tracking apps and health tracking apps, and also digital watches. So that have been utilized by many younger population. These will help them a lot in guiding them to follow a proper diet, and also guide them to understand what they are doing it right, what they are doing it wrong, and also to correct them whenever they are going in the wrong way, and also to take their material. This would also help them to guide them to take their medications on time, and also to remind them on going for the follow-up to the doctor. So these kind of apps and tracking devices would help in the long run in creating awareness, and also help the patients to follow a healthy lifestyle, good sleep hygiene, and also prevent the development of complications.
Got it. Got it. So again, my question would be, in continuation with my previous question. So as of today, what do you think these apps in particular, what do they lack, and how would what would the improvements be done to them?
I feel that these apps lack a comprehensive monitoring of the patient's condition, and also that personalized touch. So these two are the major aspects that I feel that the current apps are lacking, and they should also be including more of educational content in their apps, so that the patients would be aware of their condition, monitor the condition by themselves, because this will help the patient to have a guided approach to their sugar levels, understand their condition in a better way, and manage it in a better way to have a good glycemic control and have a normal, healthy lifestyle despite being a diabetic.
Got it, doctor. So, how has your experience been using MyTatva, and why would you recommend it to your patients?
My experience on using MyTatva has been a tremendously beautiful and very pleasant experience, you might say, if you want me to say, because I feel that they have more of a personalized approach towards the patient, and all comprehensive monitoring, detailed going into the details, and maintaining and managing the nitty-gritty of the diabetes, and regular follow-ups with the patient, especially through the diet coach, health coach, and as well as the exercise coach, that the services that they offer. These services have helped my patients to manage their diabetes in a better way, and also they also help and remind the patients to go for the regular follow. That is very much important in a diabetes management. It's not like you have come and gone and you have missed your follow-up for 6 months. So they also help the patient to remind for a regular follow-up and follow proper dietary advice. And this had helped me, because we as a diabetologist have a very busy lifestyle. We may not be able to monitor the patient's diabetes on a personal basis. So in that way, MyTatva app has helped me a lot in taking care of my patients in my absence, and so that I can concentrate on other patients. So of course, I'll be regularly updated on the patient status through the app. So these have helped me a lot in managing my patient diabetes in a very great way.
That's lovely to hear. That's lovely to hear, Doctor, about your experience.
Thank you.
Can I ask you one more question,
Yeah,
Doctor?
please. Mhm.
So, what is your thought about metabolic dysfunction, metabolic syndrome in today's world with the target group, especially like the early 20s to like late 30s, all of them have like obesity and all of these challenges like diabetes, fatty liver, all of these sort of conditions that are developing. So, can you let people know a little more about metabolic dysfunction?
Metabolic syndrome is nothing but it's a condition wherein the patient has a high blood sugar levels, though they are not diabetic, designated as diabetics. They have uncontrolled blood pressure, being overweight and obese, and dyslipidemia, that is uncontrolled, very much elevated triglyceride levels. These are conditions called as metabolic syndrome. And of late, the prevalence of metabolic syndrome has been increasing alarmingly, especially in Indian subcontinent. And I would attribute this to the stressful life that we are having nowadays, especially in the younger population. Nowadays, we can see metabolic syndrome in younger school-going kids as well, because of easier availability of junk food and Swiggy, Zomato, these kind of easy availability of junk food to our kids, and lack of physical activity, stress at such a younger age. So these factors have been contributing tremendously towards development of metabolic syndrome. And to address this, I feel the educating the general population should start from the school life itself. I feel that parents and have to should raise their voice, and also the school management also have to be more proactive in educating the kids in avoiding the junk foods, encouraging them for physical activity, and parents also should also play a role in encouraging the kids, and also in a younger population who are in their 20s and 30s, who are into recently joined jobs, avoiding stress and anxiety. And the company management also has to play a significant role here, so that they can help their employees lead a good quality of life, so there can be a prevention of type 2 diabetes, cardiovascular diseases, and other metabolic disorders, so that we can grow towards a healthier India in future.
Awesome, awesome, Doctor. That's lovely to hear. These small changes, right from younger age
Younger
for
age.
children, would make a lot of difference.
Yes.
Yeah. So, anything else apart from this that you would like to just talk about? Anything particular? Any topic? Like this is off camera. I'm just asking you as a question.
Okay.
Anything that you think would be your target audience would also want to hear, or even MyTatva? Anything that is trending in particular health, like gut microbiome was trending, and a lot of people were talking about that. Similarly, metabolism. Can I ask you one question? Actually?
Yeah. Please.
What is it that people can do to increase their metabolism or improve their metabolic health?
So if you ask me scientifically, as we grow in our age, as the age advances, the basal metabolic rate comes down drastically. So that's the reason we tend to put on weight as we grow older. There is some amount of sarcopenia. Sarcopenia is nothing but there is muscle loss, which increases the insulin resistance. So in that way, the basal metabolic rate slows down, and there is a loss of muscle, which increases insulin resistance, and this tends to increase the development of type 2 diabetes in future. So talking about that, I feel to increase the basal metabolic rate, so we have to be very much physically active, avoid sedentary lifestyle, avoid junk foods, and consume more of pre and probiotics, which increases your gut health, and stress and anxiety, and having a good sleep hygiene. These simple lifestyle changes are going to help in the long run to improve and increase the basal metabolic rate. And of course, using apps like MyTatva app will definitely help you in guiding you to lose weight, because we have excellent diet coach, sleep coach, and exercise coach who are going to guide you in a proper way to how to lose weight, because losing at least 10% of your current weight is going to significantly improve your basal metabolic rate and bring down the you can say the risk of developing metabolic syndrome and future development of diabetes or diabetes related complications.
All right, got it. Thank you so much, doctor. Thank you so much. This was insightful, and this is going to be helpful for people like me who are actually, suffering, going through metabolic syndrome and things like that. So, thank you so much, doctor.
Anytime. It was a pleasure talking to you, ma'am. Thank you. Thank you.